I am Maddie. I am 30 years old. I am a senior at University of Maryland representing. I'm a history major and I also work full-time as an accountant. I used to be a competitive figure skater, so I do like doing that on the side. I'm a big fan of like the theater and singing, and before I was a history major, I was a theater major, so that's kind of like a an active hobby of mine. Everything actually started a year before I was diagnosed because a year before I was diagnosed, I had insanely itchy skin on my feet, my legs, and my torso. And for a year, I went from dermatologist to dermatologist trying to figure out what the heck was going on because it was getting to the point where it was like I was breaking skin in the middle of the night. And um no, like none of the specialists could figure out what exactly was wrong. They said it was everything from like eczema to, oh, it's just in your head, it's anxiety. And it was incredibly frustrating because after a year of like no sleep, um I was starting to kind of accept the fact that like this is just what I have to deal with for the rest of my life. And then in April of 2015, I had scheduled an appointment with my primary care doctor because I had like this really bad cough. And the day before that appointment, I just happened to be like running my hand down my neck and I noticed a lump on the side. And I didn't really think much of it. I thought, okay, it's probably just a swollen lymph node from like an infection that would explain the coughing. And so I went into the appointment and that was like at the back of my mind. And so at the very end of the appointment, I just casually brought it up. And my doctor was just like, yeah, that's not normal. And so yeah, immediately she scheduled an ultrasound appointment, and the ultrasound led to an MRI. The MRI led to a PET scan, and that was when we knew that we were dealing with some kind of cancer. I don't think I actually started thinking the worst case scenario until a family member of mine was like, "Oh yeah, like my daughter had something similar. She was worried that it was going to be a type of lymphoma, but it turned out not to be." And that was the only time prior to getting my diagnosis that cancer was even on the radar at all. And I thought, okay, yeah, no, the odds of it is probably very slim. Um, but come to find out, Hodgkin's lymphoma is actually pretty common between ages 20 to 25, and I was 22 when I was diagnosed. So that kind of made sense. I mean, I knew I was dealing with cancer before actually finding out that it was Hodgkin's. And that I think was um, the hardest moment. Finding out what exactly it was actually a little uplifting because I kind of knew what I was dealing with and we had a plan to go forward. And the oncologist that I had at the time said something along the lines of like, oh, out of all the cancers to have, this is one of the more easily treatable ones, which no oncologist should ever say, I think, because there are so many variables. Everyone's cancer is different, regardless of what the diagnosis is. Anything could happen. And my case is a perfect example of that. I mean, I was still very upset, getting the news that I had gotten cancer. No 22-year-old really wants to hear that kind of news. I mean, that's supposed to be like when you're in your prime. I was, obviously upset in my appointment, and my oncologist was like, you have to be strong, you have to buck up, stop crying, and we're going to get through this. It's just, one chemotherapy and then you're done. And I'm like, okay, cool. So it was a bit of a rush getting into the chemo, because I mean, before I knew it, I was doing a bone marrow biopsy. And then I'm getting my port put in, and all of this was just like so much happening all at once. It was really overwhelming. And then So it was really, there weren't there weren't really any options. It was just the standard protocol at that time, and this was 2015. I don't know what it is now, but the standard protocol was, ABVD for 6 months. And I honestly can't remember how frequently I went in for infusions. I think it was every other week. I could be wrong. But I mean, I did that diligently, made every appointment on time. Um, and my mom accompanied me for every single one of those appointments. So I mean, like, there's the usual like hair thinning, the nausea, but the worst side effect for ABVD was by far like mouth sores. For some reason, I think one of the drugs that's in like the sequence, it just really aggravated my mouth to the point where I had to like eat ice chips while I was actually getting the infusion, which was so like miserable because I mean, at the time I had no appetite at all, so I didn't really want to be like eating or anything. All I wanted to do was sleep, to be honest. But honestly, out of most other patients who have had like, chemotherapy and stuff like that, they thought I tolerated it really well, and I think I did. And the reason I say that is because a lot of my friends I could have fooled easily, like with how I was going about day to day. Like I felt exhausted. All I wanted to do was sleep. I was depressed given, everything that had been blown up in my face over the course of like a few months. But um I tried to like give the outward appearance that everything was fine. And I think I did a pretty good job at that for a while there. But after doing ABVD chemo, at the end of the year, my oncologist gave me the impression that, I was basically in the clear and I can go back to normal life. And I was ready to do that. I celebrated with friends. I went back to work because I had taken disability halfway through chemo. And I thought, it's just a really bad chapter in my life. I'm going to move on. It didn't even take over a year, so it's okay. Um, and then to find out that no, it didn't really respond perfectly well to the ABVD for whatever reason. Like it responded, but not enough. Um, and after finding that out, the oncologist that I had at the time, she was like, well, I'm sorry to say, but it looks like you have less than a 5-year life expectancy. So we're looking at having to do ice chemo. We have to do a transplant, and your odds aren't really looking too good. So she recommended that I resign from my job that I had just resumed again. So at that point, that's when I was like, I need a second opinion here. I don't feel comfortable with this. We originally planned on having like the last PET scan be January, which was like a couple weeks after my last infusion of ABVD. And when that came back, there was like a little tiny residue that was in my chest. So I could feel, no lumps or anything like that, but they said that there was a little tiny like speck in the middle of my chest. And I was given the option, okay, we can assume that this is a recurrence, or there's the possibility that it's, just scar tissue. And if that's the case, then we can just do a repeat PET scan and see what happens. So I went with that option, thinking, it was behind me still. And of course, when that repeat PET scan came back, it came back aggressive. And I think at the time it was just complete shock. Um, I didn't really know what to make of the future anymore. Um, I mean, I was distressed, but months later, I look back on it, and actually, there's a lot of pent up anger around that, because it's like there are so many things that could have been done differently, and there's the possibility that it could have been avoided altogether. Like if I had gotten diagnosed sooner, or, if I had actually just treated it as a recurrence, then maybe, the whole ordeal of my cancer journey would have been shortened by like a half. So, but at the time, yeah, I was in a lot of distress, and the only thing I could think of at the time was I'm not going to just give up. I wanted to get a second opinion. I wanted to find out if there were other options besides the ice chemo, because I was told, that's out of all the chemo options out there, it's one of the more toxic ones. And I'm like, at the time I was only 23, and I still had so many things I wanted to do with my life. So, and one of them was to even, eventually have a family of my own, and to be able to have a kid of my own. But to have cancer rob me of one more thing, that I didn't really want to let that stand. So I went through the fertility treatment prior to doing the next chemotherapy. When I asked for a second opinion, they sent me actually directly to Johns Hopkins, and I saw like one of the best specialists specifically for lymphomas there. And he strongly recommended that if I want to have my kid, like don't jeopardize it. Like, you should definitely consider it. Especially because at that point I was looking at potentially doing a transplant at that time, if I ever made it to remission. And he's like, if you do a transplant, the odds of you having your own kid without any kind of assistance is pretty much impossible. I mean, I went to Shady Grove Fertility here in Gaithersburg, Maryland, and it honestly, out of all of the doctors outside of my oncologist that I like interacted with, the doctors and nurses out there were like out of this world amazing. Like I had mentioned, like it was all out of pocket costs to do any kind of like fertility preservation. And it's not just the withdrawing the eggs and everything. It's also like the lead up to that, having to go in for ultrasounds, having to go and, get the medication to like actually produce those eggs or whatever you can. And they're not cheap. And so when I had mentioned to the doctor in my first consultation that, the only reason I was doing this was because this is, where I'm at. I'm facing a bone marrow transplant in the near future. He felt really, sorry for me. And he's like, I'm gonna discuss things over with the finances department, and we'll see what we can do for you. When I went to that teaching class, they basically gave me a giant bag full of like all the meds that I would need. And they're like, don't worry about it, it's covered. The nurses all pitched in. And I just remember crying leaving the place. And yeah, they covered basically everything except for the actual like retrieval date. um and also, I mean, the preservation annually. um but without their help, I probably wouldn't have been able to do any of that. It was a mind-blowing experience, to say the least. When I asked for the second opinion, they sent me to Johns Hopkins. And that was where I found out, there are a ton of options. There are clinical trials. There's immunotherapy that had like just come out for Hodgkin's lymphoma. And even besides that, there were other chemo options out there that weren't as toxic as ice chemo. And he's like, since you're familiar with chemotherapies, um, the brentuximab has, some of the better results, and it's, not as toxic. So he recommended doing that. And after discussing it in thorough detail with him, and I had my parents with me in the room, we all decided that that was the better course. And the second oncologist that I went with ended up being the one that saved my life ultimately. So I did brentuximab after doing all the fertility treatment, and it showed some results, but all it really did was kind of stabilize the cancer. It didn't really do a whole lot, unfortunately. And then when, it became apparent after a couple months of it not doing anything, it was like, okay, we need to look at another option here. And that was when um my new oncologist was like, there are some clinical trials going on at NIH, and he basically assembled like a team of doctors from both Johns Hopkins and NIH to find out what everyone's opinions were on the situation. And he sent me over to NIH and to like basically get every scan and test done under the sun. And then I finally met with the team over there, and I had never felt like a lab rat more in my life, because they were all talking about like statistics and everything. And it was a lot. It was a lot to take in. They presented all these different options. They presented the clinical trial, and which was the CAR T cell project, but it was in its beta phase. So it had only just come out with like recent results. And they're like, before we even think about doing that, there's one more option that we kind of want you to try, which is an immunotherapy called nivolumab. And I was like, okay, sure, let's do that. Since it was basically like a chemotherapy option, but again, less toxic. And so I went with that. And that one almost killed me, actually. I went in for my first infusion thinking nothing of it. It's like any other infusion that I've gone. And I, was seeing the same crew of nurses that I'd been seeing for a year now. And I remember them hooking it up, and maybe like 2 minutes into the infusion, I couldn't breathe. I felt like something in my chest was like cut off, and I was really struggling to actually like take in another breath, and immediately hit the emergency button. And I was in a panic. And they're like, oh, well, it sometimes happens. Maybe it's because like, we were putting the drugs into your system too quickly. And so they slowed it down in the next infusion, and it kind of worked out a little easier for me. I mean, after having an incident like that, that kind of changes your perspective on like future infusions. And so you're very, very cautious going forward. After that, I mean, beforehand, I had really no major issues. I tolerated the treatments rather well. And so this kind of took me by surprise a bit. It honestly had no benefit at all, actually. And instead it actually gave me lasting problems to this day. I had like thyroid problems ever since, and prior to that drug never had any issues. So it was actually very upsetting being told that I would have to be on like medication for life when I didn't have to deal with that beforehand. Mind you, like prior to cancer and everything, I was healthy, I was active. And so this was very upsetting. And I think at that point, that's when I started to see, like, looking back on it, I see like a decline in like my mental health, because I was starting to feel very hopeless. They said that the clinical trial was still an option, but because of like how early on in the phase it was, it basically would just buy me time. And so I was like, okay, well, it's better than nothing. So after kind of composing myself and accepting the situation that I found myself in, and mind you, I had an amazing support group that I had been attending, and they all kind of like lifted me up. And when I was told that news, that we're basically facing something that's incurable, the first thing that they all kind of wanted to do was like take me out and treat me out to dinner, and we all kind of partied up. The intention was basically to say goodbye to them. Um, so with that in place, I started preparing for the clinical trial at NIH. And I had done all the tests and everything, but my lab work came back and it showed that I had increased levels of estrogen for whatever reason, despite, all the chemo that I had undergone. And they're like, because your estrogen levels are too high, you're technically not able to go through with the clinical trial just yet. So we have to put you on a hormone therapy. And in the meantime, while you're doing the hormone therapy, we're going to have you go on a salvage chemotherapy, which was GVD. And I mean, it was just supposed to hold me over until like my levels were at the right place so that I could do the clinical trial. However, like 2 months into doing the salvage chemo, which was not supposed to have really any effect, I started like bouncing back. I noticed a significant decrease in the lumps that had, recently formed after the nivolumab, and no one kind of saw it coming. So it was like, okay, clinical trial is no longer, at the forefront. We're looking at another opportunity for a bone marrow transplant. And I was thrilled and ecstatic, and I saw hope in the future. But when having the discussion about the transplant, given everything that had happened, my team of doctors was also like, they broke it up into thirds. There's a third possibility that, you accept the transplant and it goes great and you're in remission. Awesome. There's a third chance that there are complications during the transplant and cancer doesn't, go away in the end. And then we just have to basically take it from there. And then there's also the opportunity, there's also the potential third percentage that, I don't even make it at all. Like, I don't respond at all to the transplant. After having that conversation, I was still determined to go to France and see family. And, because nothing is guaranteed. And at the time when we had made travel plans, I was just reaching a state of temporary remission, and my doctor was like, you should really think about like dropping your plans and going into transplant and everything. And I was like, yes, I have every intention of doing that, but my mental health right now is at an all-time low, and I am under the impression that you have to go forward with a positive outlook here. Actually regret doing, because when I came back from my travels, there was a regrowth happening. And at first my oncologist was sort of optimistic. He's like, the GVD had worked before. Let's have you go back on it for another, 2 infusions and see what happens. And it became apparent that I was no longer responding to it. So I was right back where I was at the start, having to face the decision. And it was the final decision at that point. Either I'm going to go into the clinical trial, or I'm going to do the last option available to me, which was the ICE chemotherapy, which my first oncologist was the one who recommended from the start. And I remember having that conversation with my oncologist over the phone. And surprisingly, I wasn't really upset anymore. I think it was because I had actually, taken the initiative and actually going to see family and doing what I wanted to do in my life, that I was content with whatever outcome was going to happen at that point. And I asked my oncologist, I'm like, can I have a day to think about which option I want to go with? Because both, had major risks involved. And he's like, okay. So the next day, I basically spent the entire time just contemplating and thinking and weighing the pros and cons. And deciding what I felt more comfortable with. And when my oncologist finally called over the phone, I just had a very, very strong gut feeling. I can't even really describe it. I had a really strong gut feeling that doing the ice chemo was the right thing to do. And when I told him that specifically, he's like, if you have a good feeling about it, then I'm all for it. And so we went with the ice chemotherapy, and that ended up actually being the miracle. So ice was a whole different game, because unlike the previous infusions where I just went to my doctor's office and sat in the infusion center there for a couple hours, I actually had to be hospitalized this time. And that was the first time I ever had to be hospitalized through the whole cancer situation. Side effects were pretty brutal. I was very nauseous, very fatigued. After the second infusion of ice, there are only 3 that are given. After the second one, I didn't feel any lumps anymore. I had a very strange feeling that like this had actually worked. And so my oncologist was like, okay, well, you know what? Let's schedule a PET scan like first thing tomorrow. And the PET scan showed almost a complete remission. And no one expected that. It shocked not only my oncologist, but also the whole team of doctors that, had been in communication. And they're like, oh my God, we need to fast track her into a transplant immediately. For me, I had an allogenic bone marrow transplant. Originally, the idea was to get an autologous, which is a lot easier. You're not dealing with a donor, you're dealing with your own cells. But because of all the relapses that I had, or the recurrences I had, that was off the table. So we were dealing with a donor, and that poses more complications, or the potential of more complications, specifically graft versus host disease. And because of that, they basically have you stay at the hospital for, whatever length of time they recommend. And for me, they recommended 3 months of being in and out of like constant care. They had me stay in housing right across the street from the cancer center at Johns Hopkins. And I basically would just walk across the street every other day almost, just to get, looked at, taken like my vitals. And every once in a while I had to do like blood transfusions, because when you go through the process of a bone marrow transplant, your immunity is like basically shot. You undergo like 5 days of really, really aggressive chemotherapy, followed by total body radiation. And I did that for 20 minutes. And then you do the transplant. The funny part is that they say that like the transplant is supposed to be like the most boring day out of the whole duration that you're out there. But for me, of course, my odds have never been great. That ended up being the scariest day of my life, because even though my sister and we were pretty much a perfect match, we had different blood types. And when they collected her bone marrow, some of her blood cells got in, and it kind of like triggered a horrible reaction, to the point where I had to stay under observation for over 24 hours. And I was in and out of consciousness. I was just absolutely sick. And every time I would like get back into consciousness, it was like the thoughts going through my head were like, oh, this is it. This is what they were talking about, that third possibility. But yeah, after that, it's just basically they're just monitoring you, and you're taking, antifungal, antibacterial medication. just to try to like watch as your levels slowly climb back up from ground zero. But, as I steadily approached the end of the whole transplant ordeal, and I knew that I was getting like the catheters taken out, I was like, I've been standing on the sidelines for so long, watching all my friends move on with their lives. And I was like, I've been given basically a second lease on life. So I want to get back out there. I want to go and do the things that I want to do, which was first go back to school and get my degree. So after speaking with like the nurses and stuff like that, I managed to sign myself up and register for classes that summer. And it was kind of like the way to distract me from all of the horrible stuff that had happened over the last 3 years. And I kind of put all of that in a closet in the back of my mind, locked it away, and was like, I'm going to focus on my studies. I'm going to get straight A's. I made the dean's list every semester. But that stuff catches up with you after some time. At first, it was really uncomfortable because, I'm going back to school and my head is like shaved, and I didn't recognize my body anymore. I basically, from like all of the stuff that had happened, from the thyroid problems, like I ballooned and I hated my appearance. I just felt very uncomfortable, but I was still so determined to like try to reclaim whatever, normal part of my life I could, that I just, kept my head down, focused on my studies. And I mean, the following year, I also got a job part-time, working at a grocery store just to get myself through school. And it was an interesting transition, to say the least. First, don't ever make the mistake that I made, by just assuming that, standard protocol is the thing for you, because it might not be. I strongly recommend getting a second opinion, even if your oncologist is one that you really like. Always get a second opinion from, a specialist or another oncologist or someone, because there might be treatment options that they, aren't even aware of that another person might be. So there's that. When it comes to picking a treatment option, if you have more than one option available, the only thing I would say is look at not just the statistics, but look at, the side effects. You have to basically weigh the pros and cons and figure out what you think your body is going to be able to tolerate. The reason I went with the ICE chemo over the clinical trial was because it was something that I was more familiar with and that I knew that my body would probably be able to tolerate, even if it was the more toxic out of the two. And that's on top of the fact that, like, statistically, there was a better outcome that way than through the clinical trial, which I'm sure, statistics constantly change. Everyone's cancer is unique. I wasn't like, if you look at statistics, I wasn't supposed to have pulled through this. And I think, yeah, the doctors really need to consider that, because you're kind of giving your patients false hope that way, and it only bites them in the end. But the other thing I would say, that isn't really related to the whole, this is the better cancer thing, definitely prioritize your mental health, because that's something that even after your chemo treatments and everything, that's going to play a huge role in your recovery process. That was something that I didn't address immediately. And I kind of wish I had, because the more you put that off, the more you kind of think, oh yeah, I'm fine now, life is going to go back to normal, the harder it's going to be to kind of move past all of the trauma that you went through. And even if it's like 6 months or 3 years of chemo, it's still a huge impact to your life. your whole world gets flipped upside down. And that's something that you need to address with, a professional. And I strongly recommend to prioritize your mental health just as much as you value your physical health. I mean, my story is still ongoing. I guess you could say the curse of cancer is the fact that it's always going to be in the back of my mind, but the further away you are from, that moment of actually getting the declaration of remission, the easier it gets. The more time that elapses, the easier it gets. And I probably wouldn't even be here right now if it wasn't for the support system that I have in place, not just with the therapist, but family, my very close friends, my support group that got me through it. Like I have so many people to thank for just being here. And the only way I can really kind of give that back is just to be there for others and give as much support as I possibly can to the cancer community.